Sorry if some of you were coming to see Stephen Omolo. I know his name is in the program. He's a tall Kenyan man. I'm clearly not. I'm a somewhat short Irish-Canadian woman, so apologies if that's disappointing. That's right off the top, really. I'm grateful to my colleagues in FAO for this partnership of coming together to present this workshop on why bringing nutrition and resilience together is so critical today. In the Federation, as many of you know, we work with national societies around the globe to build their capacity to be more responsive to the most vulnerable, to people in need, whether they're facing immediate disaster or long-term development challenges. And certainly, like many organizations that we're discussing, resilience is a key area that we are building policy and practice around. We, like many organizations, have a definition. You have to have a definition, and they tend to be somewhat different from each other, but tend to get to the same place. Our definition is the ability of individuals, communities, organizations, or countries exposed to disasters, crises, and underlying vulnerabilities to anticipate, to reduce the impact of, cope with, and recover from the effects of adversity without compromising the long-term perspectives and prospects. This is our definition in the Red Cross movement. We attempt to address the root causes of food and nutrition insecurity within this definition and link them to poverty. We see them as aggravated by challenges such as climate change and other related hazards. And we believe that the level of vulnerability is associated with a person's capacity to prepare for and cope with disasters. Humanitarian actors to date, I think as we all know, don't tend to address root causes of a community's vulnerability or household level vulnerability. And as a result, disaster affected individuals and communities continually cycle through the crisis of disaster. Within the Federation, we've invested a significant amount of resources into disaster risk reduction and resilience. This has increased fairly steadily over the last few years. In 2013, we invested 122 million CHF and reached 25.6 million people. We use a set of principles in exploring ways to improve and strengthen our resilience programming, and those include, similar to what our colleagues in FAO are talking about, that we have to put people first, that we have to have local ownership, there has to be leadership within the national or local community, that we need a long-term perspective. In the humanitarian sector, we don't tend to have a long-term perspective, and that's something that we really, I think resilience demands us to look at the long-term. We have to have a comprehensive approach, so this integrated or multi-sectoral approach that looks at the interdependencies between different sectors, different components of resilience, different areas that we operate in. That we have to recognize what our organizational limits are, what communities' limits are, and we have to embrace partnership because we can't do it alone. Part of what we're doing in the Federation is continually learning and looking for ways to scale up. Some of the examples that I'm going to share with you, a bit of a rapid fire tour around Africa of some of the work that we're doing, is an attempt to show you the variety of resilience programming, but also the commonalities within our programming. I'm sure you will relate to a lot of what we're doing as well. And hopefully what you'll see is some of the linkages to what FAO we're discussing in terms of rates of malnutrition. Most of the countries that we're highlighting here, give or take one or two, are in that map of those 34 countries with experiencing high levels of malnutrition. So let's go to Mauritania, where they have used a twin track approach to respond to the food insecurity that the country suffered in 2011, where rates of malnutrition were up by 22%. The Mauritanian Red Crescent Society and the International Federation responded with a proactive two-twin approach. That meant we looked at immediate needs, and we also started to look at long-term development needs at the same time. In terms of immediate intervention, the Mauritanian Red Crescent provided 2,000 families in 17 villages with sorghum, cowpea, watermelon seeds, as well as insecticides to control pest invasions. At the same time, technical guidance and support was given to 28 women's cooperatives, so looking at the gender elements as well, to support market gardens. And 18 of these cooperatives also received seeds and tools. The results were quite dramatic, where we had vegetable gardens flourishing in the desert. And I think the benefits were numerous. Women say their families were healthier because they're regularly eating vegetables. Moreover, women were empowered with money that they were earning to reinvest their income and in their families. And looking at urgent community needs, they were able to move beyond the household level and look at things such as fixing broken water pumps. In Namibia, the Namibian Red Cross partnered with the International Federation and the FAO to work in 3 regions on an integrated food security project. This integrated food security project started in 2011, and it aimed to strengthen resilience in vulnerable communities and with households at risk of food insecurity. It was built on a community-based model that the Namibian Red Cross were well known for, and that in the Red Cross in general we use, which is the utilization of volunteers. And it meant that volunteers participated, as did communities, in the identification of the program, in the design of the program. They created organization and management committees who worked with the local Red Cross branch to produce proposals and to look at ways in which they could create startup initiatives. This ensured sustainability of the initiative in the long term and allowed the partners to really address issues around food availability, food access, and tackle malnutrition. This program was part of a broader program, Zambezi River Basin project, that I'll talk about a little bit later. So trying to look at ways to scale up and look at the links between different communities in the region, not just in one particular area. In Niger, the Niger Red Cross has been attempting to tackle malnutrition directly. In normal times, as FAO were talking about, stunting rate of children in Niger is over 50%, one of the highest in the world. Wasting rates are also very high, usually around 12%. And so the French Red Cross and the Niger Red Cross have been partnering for many years, and they came together to look at capacity building for the health sector. They set up programs to fight malnutrition on a long-term basis, not just as a disaster response approach. They worked with integrated healthcare centers and equipped them with scales and height gauges for evaluating children's nutritional status, as well as medical equipment. They also provided therapeutic foods. In addition, the Red Cross ran awareness-raising programs to increase knowledge of nutrition and to identify acutely malnourished children in the community. These awareness-raising campaigns were conducted by the Niger Red Cross, by their volunteers. So again, a community-based approach that looked at sustainability as well as connection to longer-term issues, as well as gender-related of concerns by looking at early and exclusive breastfeeding messages, complementary feeding. They looked at treated bed nets and the importance of vaccination. So again, bringing in other sectors as well. In Kenya, the Kenya Red Cross really looked at a targeted, well-planned, small-scale recovery program and in addressing strengthening hunger resilience. This was as a response to the drought and recurrent droughts and promoting livelihoods to help communities adapt to future drought and other climatic variability. The project that Kenya Red Cross put in place aimed to improve and diversify agricultural production and seasonal income options, and reducing dependence on rainfall in a way that is sustainable during the dry season and could be managed by the community. Its aim was also to improve access to clean water and sanitation facilities and awareness of hygiene promotion. Some of the outcomes that came out of this program that were about building the capacity of target groups and sustaining livelihoods, as well as looking at water and sanitation, really was the increased production of food, increased income levels at the household level, and enhanced self-reliance around communities.
You've said so much in 8.
It's painful. I have so many stories to tell. Okay. As well as a documented increased knowledge amongst the community on agriculture and management. So we're looking at asset protection. We're looking at sharing knowledge at community level and embedding that knowledge in community in order to ensure sustainability. In Rwanda, the Rwanda Red Cross took a livestock rotation approach where they provided herds of cattle, pigs, goats, rabbits, and other livestock at targeted communities. The aim was that the number of selected beneficiaries should directly receive livestock and that they should take care of and manage them. In order that each household in the community received livestock, the firstborn of each of the herd was then shared out with other members of the community. This created enormous positive benefits in terms of a large number of beneficiaries being reached, a community-based approach where the community was interconnected in the success and asset building of the initiative, and households were able to sell excess farm produce at local markets. In Ethiopia here, we're working in Tigray, and we're expanding our resilience programming to Somali region. The project that we're initiating in Tigray with the Ethiopian Red Cross is an integrated program. So it's looking at livelihood diversification, health, water, sanitation, nutrition messages, as well as disaster risk reduction. This is a core program for the Ethiopian Red Cross that they're looking at building and expanding in other areas. They're starting in Somali region this year, and of course the emphasis there will be on water in particular. The project itself is, so far it's been running for about 5 years, and the successes have been very interesting in terms of really interesting results on credit and household food consumption and health knowledge at community level. Some of the challenges have been linking the nutrition and health messaging with the livelihoods programming that we've been doing through the micro loans. So we work a lot with the national societies at country and community level, and what we also try to do is look at areas where we can scale up. I think that's a core element of what the Red Cross movement is trying to do globally. It's not only work at country level, it's to look at areas, particularly in food and nutrition security and livelihoods programming in Africa, where we can have more impact. In Africa, one of the programs that we've initiated is called the Zambezi River Basin Initiative. And it is about creating space for our national societies to work together across borders. Its focus is on reducing vulnerability, building community capacity to be more resilient, and it's an integrated multi-sectoral approach. It's premised on the assumption that integrated and coordinated programs are more effective and that they have further reaching impacts on community livelihoods than standalone disaster risk reduction or standalone disaster response programs do. The national societies are located in the midst of the river basin, and so they bring different and unique skills because they're volunteer-based programs, but they also build and share information and knowledge with one another. So some of the approaches include conservation-based farming techniques, soil conservation, water harvesting, and reforestation. We see this as a climate adaptation approach and integral for building resilience in this particular area. So the examples I've tried to share with you are all similar in that they are trying to look at ways to link nutrition and food security with livelihoods and a multi-sectoral approach to look at health, water and sanitation and other areas. I think the comparative advantage of what the Red Cross, Red Crescent brings to these initiatives is that we have local and national reach through volunteers. We have technical capacity to look at absorptive, adaptive, and transformative capacities, and we have global partnerships with FAO, for example, and links to as auxiliaries to government and the national level to government projects like the PSNP or initiatives that I think we could link up with much more effectively. So thank you. I went over and I apologize profusely.
That's okay.